immediately full HeyGen script, Dr. Sienna Black, single avatar, 4,200 words. I want to start today's video with a question, and I need you to think about this honestly before you answer. Have you ever been lying in bed at night? Everything is quiet, you are finally trying to rest, and your legs just will not let you? Maybe they ache. Maybe they feel restless and uncomfortable in a way you cannot quite describe. Maybe there is a crawling or tingling sensation that makes you want to move them constantly. Maybe your calves cramp so painfully that they jolt you awake from a dead sleep. Maybe your feet feel cold and numb no matter how many blankets you pile on. Or maybe, and this is the one I really need you to pay attention to, one or both of your legs swell up during the day, and by evening they feel heavy and tight and uncomfortable in a way that did not used to happen. If any of those experiences sound familiar, and for millions of Americans over 60 they sound very familiar, then I need you to watch every single minute of this video. Because what your legs are telling you at night is one of the most important health conversations your body will ever try to have with you. And most people are not listening. Most people chalk it up to getting older. They take an ibuprofen, they prop up their feet, they wait for it to pass. And sometimes it does pass. But sometimes, and this is what I need you to understand today, what is happening in your legs at night is a warning signal from deep inside your cardiovascular system, your nervous system, or your circulatory system. A signal that something serious is beginning to develop. And catching it early, responding to what your body is telling you right now, can make an enormous difference in what happens to your health over the next 5, 10, 20 years. My name is Dr. Sienna Black. I am an internal medicine physician with over 15 years of clinical experience working with older adults. And I want to be completely honest with you today. The way I would be honest with a family member sitting across from me in my office, not with vague reassurances, not with complicated medical language designed to confuse more than clarify, but with the real, clear, actionable information you need to understand what your legs might be telling you and what to do about it. So let us get into it. Your legs are one of the most revealing windows into your overall health. Think about it anatomically for a moment. Your legs are the farthest point from your heart. Blood has to travel the greatest distance to reach them and then fight against gravity to make the return journey back up. Your legs contain some of the longest nerves in your body, nerves that travel all the way from your lower spine down through your thigh and calf to the tips of your toes. Your legs are crisscrossed with a complex network of arteries bringing oxygen-rich blood down and veins returning oxygen-depleted blood back up. A system that depends on healthy vessel walls, functioning valves, and adequate pumping pressure to work properly. And your legs contain major muscle groups that are metabolically active and highly sensitive to changes in blood sugar, electrolyte balance, circulation, and nerve function. What this means practically is that when something starts to go wrong anywhere in your cardiovascular system, your circulatory system, your nervous system, or your metabolic system, your legs often feel it first. And they often feel it most prominently at night. Why at night specifically? Because during the day when you are moving around, muscle contractions help pump blood back up toward your heart. When you lie down and stop moving, that muscular pumping assistance disappears. Circulation slows. Nerves that were managing fine during activity now have to cope with reduced blood flow in stillness. And whatever underlying problem exists, whether it is a circulation issue, a nerve issue, a metabolic issue, or a combination, tends to become more symptomatic when the support of movement and activity is removed. So nighttime leg symptoms are your body speaking to you in its clearest voice. And today I am going to teach you exactly what it might be saying. The first thing your legs might be telling you at night is that your circulation is compromised. And this is one I take very seriously in every patient over 60. The condition I am most concerned about is called peripheral artery disease, PAD for short. Peripheral artery disease occurs when the arteries that carry blood to your limbs, your legs and feet specifically, become narrowed and hardened due to the buildup of plaque inside their walls. This is the same atherosclerotic process that causes heart attacks and strokes, the same accumulation of fat, cholesterol, calcium, and inflammatory cells that we discussed in our last video about blood pressure. But in peripheral artery disease, the primary target is the arteries of the legs rather than the heart or brain, and the consequences of reduced blood flow to the legs can be severe. The classic symptom of peripheral artery disease is something called claudication, a cramping, aching, or burning pain in the calves, thighs, or buttocks that comes on during walking or exercise and goes away with rest. But I want to talk specifically about what peripheral artery disease can do at night, because nighttime symptoms are often what finally brings patients to my office. When peripheral artery disease progresses to a more severe stage, patients begin to experience something called rest pain. This is pain in the feet and lower legs that occurs when lying down, often waking people from sleep. Because in the horizontal position, gravity can no longer assist blood flow downward into the legs. Patients describe it as a burning, aching pain in the foot or toes that is somewhat relieved by hanging the foot off the edge of the bed or standing up, because those positions use gravity to restore some blood flow. If you have experienced this, if your feet or lower legs ache or burn when you are lying down and it gets better when you get up or dangle your foot, please do not wait. See your doctor and ask specifically about peripheral artery disease. Other nighttime signs of compromised circulation include feet that feel persistently cold even in a warm room, legs or feet that look pale or bluish when elevated, and leg hair that has thinned or disappeared. Because hair follicles need adequate blood supply to function, these are not normal signs of aging. These are circulation warning signs. The second thing your legs might be telling you at night is that your veins are struggling. And this is an entirely different problem from arterial disease, but one that is also extremely common in adults over 60. The condition is called chronic venous insufficiency, and it occurs when the valves inside the veins of the legs, valves that are supposed to prevent blood from flowing backwards, become weakened or damaged. In healthy veins, these valves open to allow blood to flow upward toward the heart and then close to prevent it from falling back down. When those valves fail, blood pools in the lower legs and feet, and the result is the swelling, heaviness, and aching that so many older adults experience. Symptoms that tend to worsen throughout the day as gravity pulls more blood into the legs and improve overnight when lying down removes the gravitational burden. You might notice that your ankles and lower legs are relatively normal in the morning, but noticeably swollen and uncomfortable by evening. Your shoes may feel tight by afternoon. The skin over your lower legs may look discolored, taking on a brownish or reddish tinge over time from the iron deposits left by red blood cells that have leaked through stressed vessel walls. In more advanced cases, the skin becomes thickened, leathery, and prone to breakdown, eventually leading to venous ulcers that are very difficult to heal. Nighttime specifically brings aching, heaviness, restlessness, and sometimes cramping as the pooled blood and accumulated fluid create pressure in the tissues. Chronic venous insufficiency is not life-threatening in the way that arterial disease is, but it is progressive if left unaddressed. It significantly reduces quality of life, and it can lead to serious skin and wound complications in older adults. Compression stockings, leg elevation, regular walking, and in some cases, medical procedures to treat the affected veins are the main approaches. But the starting point is recognizing the pattern and talking to your doctor about it. The third thing your legs might be telling you at night, and this one affects tens of millions of Americans and is massively underdiagnosed, is that your nervous system is under stress. The condition is called peripheral neuropathy, and it refers to damage or dysfunction of the peripheral nerves, the nerves outside the brain and spinal cord that control sensation and movement in the arms, legs, hands, and feet. The most common cause of peripheral neuropathy in adults over 60 is diabetes, specifically the chronic high blood sugar that damages the delicate small blood vessels that supply the nerves, gradually starving them of the oxygen and nutrients they need to function. But peripheral neuropathy can also be caused by vitamin B12 deficiency, which is surprisingly common in older adults, especially those taking the diabetes medication metformin, which interferes with B12 absorption. It can be caused by kidney disease, by thyroid disorders, by certain medications, including some commonly prescribed cholesterol drugs and blood pressure medications, by alcohol use, and by a range of other conditions. The symptoms of peripheral neuropathy are often most prominent at night when there are fewer distracting sensory inputs competing for your attention. People describe burning, tingling, pins and needles, electric shock sensations, stabbing pain, or a feeling like their feet are wrapped in tight bandages. Some people experience numbness, a loss of sensation that means they cannot feel where their feet are in space, cannot feel the floor under them when they get up at night, and are at significantly elevated risk of falls in the dark. Others experience hypersensitivity, where even the light touch of a bedsheet against the feet is unbearable. Peripheral neuropathy is not something to manage with over-the-counter pain relievers and hope. It is something that needs a diagnosis, an identified underlying cause, and a treatment plan, because in many cases the underlying cause is treatable, and addressing it can slow or stop the nerve damage from progressing further. The fourth nighttime leg symptom I want to talk about is one that I have already mentioned briefly in a previous video but needs a much more thorough discussion, and that is restless leg syndrome. Restless leg syndrome, RLS, is a neurological condition characterized by an overwhelming, irresistible urge to move the legs, typically accompanied by deeply uncomfortable sensations that are difficult to describe, but that patients often characterize as crawling, creeping, pulling, throbbing, itching inside the legs, or electric sensations. The defining feature of restless leg syndrome, the thing that distinguishes it from other leg discomfort, is that it is worse at rest, particularly in the evening and at night, and it is temporarily relieved by movement. Walking around, stretching, shaking the legs, these provide temporary relief. But the moment you stop moving and lie back down, the sensations return. This makes falling asleep and staying asleep extraordinarily difficult. People with severe restless leg syndrome can be awake for hours every night, unable to find a comfortable position, pacing the floor, unable to rest. The sleep deprivation that results from untreated restless leg syndrome is not merely a quality of life issue. Chronic poor sleep raises blood pressure, impairs immune function, accelerates cognitive decline, increases the risk of depression and anxiety, and creates a cascade of metabolic problems, including insulin resistance. Restless leg syndrome is significantly associated with iron deficiency, even when iron levels are in the low normal range rather than overtly deficient. It is strongly associated with kidney disease. As we discussed in our last video, the buildup of uremic toxins affects the nervous system in ways that produce restless leg symptoms. It is associated with certain medications including antihistamines, antidepressants, and anti-nausea drugs, and it has a significant genetic component. If one of your parents had it, your risk is substantially elevated. The good news is that restless leg syndrome is very treatable once it is properly diagnosed. Iron supplementation when deficiency is present, dopamine-related medications, lifestyle modifications, and addressing any underlying kidney or metabolic issues can dramatically improve symptoms. But treatment starts with a diagnosis. And a diagnosis starts with you telling your doctor exactly what you are experiencing at night instead of just living with it. The fifth nighttime leg symptom, and this one carries the most immediate urgency of everything I have discussed today, is sudden severe pain, swelling, warmth, or redness in one leg. Because one of the things these symptoms can represent is a deep vein thrombosis, a blood clot that is formed in one of the deep veins of the leg. Deep vein thrombosis is a medical emergency, not a situation to watch and wait on, not something to prop up and hope resolves overnight. A medical emergency. Here is why. A clot that forms in the deep vein of the leg can break off and travel through the venous circulation to the lungs, a condition called a pulmonary embolism. A large pulmonary embolism can be rapidly fatal. Even smaller pulmonary embolisms can cause permanent lung damage, chronic breathing difficulties, and a significantly elevated risk of future clotting events. The classic presentation of deep vein thrombosis is pain, swelling, warmth, and redness in one calf or one leg, typically just one leg, which distinguishes it from the bilateral swelling of venous insufficiency or heart failure. The leg may feel hard or firm to the touch. The skin over the clot area may be warm and red. You may have a low-grade fever. The pain may be worse when you flex your foot upward. Risk factors for deep vein thrombosis include recent surgery or hospitalization, prolonged immobility such as a long flight or car journey, dehydration, cancer and cancer treatments, hormone medications, a personal or family history of blood clots, obesity, and simply being over 60 with compromised venous function. If you have one leg that is swollen, painful, warm, and red, especially if it came on relatively suddenly, do not wait until morning. Do not take an aspirin and see if it improves. Go to an emergency room or urgent care immediately and tell them you are concerned about a blood clot. Time matters enormously with deep vein thrombosis. So let us bring everything together and talk about what you should actually do with all of this information. There are 5 potential messages your legs might be sending you at night. Compromised circulation from peripheral artery disease, signaled by cold feet, rest pain in the feet and calves when lying down, pale or bluish discoloration, and absent leg hair. Venous insufficiency, signaled by legs that swell progressively through the day, feel heavy and achy by evening, and show skin discoloration over time. Peripheral neuropathy, signaled by burning, tingling, numbness, electric sensations, or hypersensitivity in the feet and lower legs, particularly at night. Restless leg syndrome, signaled by an irresistible urge to move the legs at night accompanied by crawling or creeping sensations that are temporarily relieved by movement. And deep vein thrombosis, signaled by sudden onset of pain, swelling, warmth, and redness in one leg that represents a potential medical emergency. Now, I want to be clear about something important. I am not telling you this to frighten you. I am telling you this because knowledge and early action are the most powerful tools in medicine. The vast majority of people who experience nighttime leg symptoms have manageable conditions that respond well to treatment when caught early. Peripheral artery disease caught in its early stages can be significantly slowed with lifestyle changes, medication, and sometimes minimally invasive procedures. Venous insufficiency managed with compression and lifestyle modifications can remain stable for many years. Peripheral neuropathy addressed at the root cause level, controlling blood sugar, correcting vitamin deficiencies, adjusting medications, can stabilize and in some cases improve. Restless leg syndrome treated appropriately allows people to sleep through the night again, which has cascading positive effects on blood pressure, cognition, mood, and overall health. What I want you to do after watching this video is simple. Write down exactly what you experience in your legs at night. Be specific. Is it one leg or both? Is it pain or tingling or restlessness or swelling? When exactly does it happen? As you are falling asleep in the middle of the night, in the early morning. What makes it better and what makes it worse? Does movement help? Does elevation help? Does hanging the foot off the bed help? Write all of this down. And then make an appointment with your doctor and describe it specifically. Bring your written notes. Ask your doctor to check your circulation with an ankle brachial index test if you have symptoms suggesting peripheral artery disease. Ask them to check your blood sugar and HbA1c if you have symptoms suggesting neuropathy. Ask for a complete blood count and iron studies if you have symptoms suggesting restless legs. Tell them what you experienced when you experienced it and what makes it better or worse. Be your own advocate, because the information you bring to that appointment is the information your doctor needs to give you the right answers. I have seen patients wait years before mentioning nighttime leg symptoms to their doctor, dismissing them as just getting older, being embarrassed to bring it up, not wanting to make a fuss. And I have seen what happens when conditions that were completely manageable in their early stages are allowed to progress untreated. Please do not be that patient. Your legs have been carrying you through every single day of your life? Or they deserve your attention when they ask for it. I am Dr. Sienna Black. If this video helped you today, please hit the like button and share it with someone you love who is over 60. Subscribe to Healthy After 60 for new health videos every single week. And I will see you in the next one. Take care of yourself. Your health cannot wait. There is one more thing I want to address before I close today, because I know it is on the minds of many of you watching this. And that is the question of when nighttime leg symptoms are serious enough to act on immediately versus when they can wait for a scheduled appointment. Because I know that many of you, particularly those of you who grew up being told not to make a fuss, not to bother the doctor over small things, not to go to the emergency room unless you are absolutely certain something is terribly wrong, struggle with knowing where that line is. So let me give you clear, specific guidance. Go to an emergency room immediately. Do not wait. Do not call for an appointment. If you have sudden severe pain, swelling, warmth, and redness in one leg that came on within the last day or two, because this could be a deep vein thrombosis, go immediately if you have a leg or foot wound or sore that is not healing and you have diabetes or known circulation problems, because infected non-healing wounds in people with compromised circulation can progress to limb-threatening infections with terrifying speed. Go immediately if you develop sudden severe pain in both legs accompanied by weakness or numbness, because this can represent a spinal emergency. Go immediately if your foot or lower leg becomes white or blue and cold and extremely painful very suddenly, because this can represent acute arterial occlusion, a blockage of blood flow that constitutes a true vascular emergency where time to treatment is measured in hours before permanent damage occurs. Call your doctor for an urgent appointment within the next few days. Not an emergency, but not something to push to your next routine checkup. If you have been experiencing rest pain in your feet or calves when lying down that gets better when you get up or dangle your foot, call if you have noticed that one of your legs consistently swells more than the other. Call if you have developed new numbness in your feet that is affecting your balance or your ability to feel the floor when you walk. Call if your restless leg symptoms are severe enough that you are regularly getting fewer than 5 hours of sleep per night. Call if you notice new skin changes on your lower legs, discoloration, thickening, or the beginning of what looks like a sore or ulcer. These are situations that need medical evaluation relatively promptly, within days rather than weeks, but that do not require you to go to an emergency room in the middle of the night. And then there are symptoms that you should mention at your next regular appointment, things that are worth documenting and discussing, but that do not necessarily require urgent action. Mild aching or heaviness in the legs at the end of the day that is relieved by elevation. Mild restless legs, symptoms that are manageable and not severely disrupting your sleep. Occasional mild cramps that resolve on their own. Feet that feel slightly colder than they used to. These are worth mentioning, worth investigating, worth keeping an eye on, but they do not represent the same level of urgency as the symptoms I described above. The key principle I want you to take away is this. You know your body. You know what is normal for you and what represents a change. Trust that knowledge. When something in your legs at night feels different from how it used to feel, when a symptom is new or worsening or beginning to affect your sleep or your daily function, that is your body asking to be heard. Honor that request. Make the appointment. Describe what you are experiencing clearly and specifically. You are not being dramatic. You are not wasting anyone's time. You are being a responsible steward of your own health. And that is exactly what I want for every single person watching this channel. I want to close by sharing something that one of my patients, a 74-year-old retired firefighter named Robert, said to me recently that I have been thinking about ever since. Robert had been experiencing burning and tingling in his feet every night for almost 3 years before he finally mentioned it to me. 3 years. He had attributed it to tired feet, to wearing boots all his life on the job, to just getting older. When he finally described it, I immediately ordered blood work, and we found that his blood sugar had been in the diabetic range for probably 2 years without a formal diagnosis. We also found a significant vitamin B12 deficiency. Robert had been developing peripheral neuropathy from uncontrolled diabetes and B12 deficiency for over 2 years. And nobody knew because nobody had asked and he had not said anything. We got him on appropriate diabetes management, B12 supplementation, and a nerve supportive treatment plan. His symptoms have improved meaningfully, but he told me, "I wish I had said something sooner. I kept thinking it was nothing. I kept thinking I was just getting old." And I want to tell every person watching this, getting older does not mean accepting pain and discomfort and disrupted sleep as your new normal. Getting older means paying closer attention to what your body is telling you and responding to it with the same care and respect you would give to anyone you love. Your legs are talking to you tonight. I hope after watching this video, you know how to listen. I am Dr. Sienna Black, and I will see you in the next video. Take care of yourself. You deserve to feel well. One final thought before I truly sign off today. Throughout this video, I have talked about 5 different conditions: peripheral artery disease, venous insufficiency, peripheral neuropathy, restless leg syndrome, and deep vein thrombosis. And I want to acknowledge something important. These conditions do not always present in isolation. In my clinical experience, older adults very commonly have more than one of these issues occurring simultaneously. Someone with diabetes may have both peripheral neuropathy from nerve damage and peripheral artery disease from the accelerated atherosclerosis that diabetes promotes. Someone with chronic venous insufficiency may also develop restless leg syndrome because venous disease is one of the known contributors to restless legs. Someone with kidney disease may experience both neuropathy and restless legs because kidney disease affects both nerve function and the iron and mineral balance involved in restless leg syndrome. This overlap matters because it means that a thorough evaluation of nighttime leg symptoms often needs to look at multiple systems simultaneously rather than stopping at the first diagnosis found. If your doctor finds venous insufficiency, but your symptoms include significant burning and tingling as well as heaviness, both issues need to be addressed. If restless legs is diagnosed but you also have cold feet and absent leg hair, peripheral artery disease needs to be evaluated as well. Be complete in describing all of your symptoms. Do not let a partial answer satisfy you if you are still experiencing things that have not been explained. You deserve a complete picture, and a complete picture starts with a complete conversation. I am Dr. Sienna Black. Thank you for watching Healthy After 60. Please subscribe, please share this with someone you care about, and I will see you in the next video.